to discuss the world and Jasmine, and today we'll talk about the most important and serious things happen now, that is COVID-19 coronavirus. So first, we need to know what is coronavirus. Coronavirus is a type of virus. There are many different kinds and some cause disease. COVID-19 is the newest kind started now. Next, we need to know how serious is it now. I will show you one number and two pictures. This is the number 1,528,525. This is the number people got confined in the world. So that just means it's easy to infect. And this is the picture COVID-19 map. The place is more darker, such like America and some of the Europe. That just means there are more cases. And next, this is the list of each country's cases that's recovered. Next, we need to know the symptoms. People may be cough, have a fever, tiredness, or difficult to breathe. If that happened to you, you may got the virus. Then we have two videos to show you something about the virus. The first video is tell you what you can do and must do during the coronavirus.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing, after traveling to Wuhan or having close contact with someone who was ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who's been confirmed to have the virus. The CDC defined close contact as being within about 6 feet, 1.8 meters, or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Avoid animals and animal markets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
Okay, so this is the video to tell you what can you do and must do during the coronavirus. So here I have a few summaries. 4 points. First, close contact is about 1.8 meters, 6 feet. Next, avoid the people who have just played the symptoms. Third, don't touch your eyes, mouth, and nose with unwashed hands. Last, avoid animal or animal market. And here we had the second video to tell you how to protect yourself.
Coronavirus disease 2019, abbreviated as COVID-19, is a respiratory illness that spreads from person to person. It's caused by a new virus that was first detected in China and has now been detected around the world, including the United States. The World Health Organization, the U.S. Centers for Disease Control and Prevention, and other public health authorities are still learning about this virus and are working hard to control its spread and make sure our communities are prepared. You can help protect yourself and those around you from getting and spreading respiratory illnesses like COVID-19 by taking some simple precautions. One of the most effective ways to prevent the spread of germs is to wash your hands often. Make sure to scrub with soap for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Hand washing isn't the only preventative measure you should take to reduce the spread of germs. It's also important to avoid close contact with people who are sick and keep at least 6 feet between yourself and anyone who is coughing or sneezing. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue, then immediately throw the tissue in the trash. If you don't have a tissue, cough or sneeze into a bent elbow instead. Never cough or sneeze into your hands or into the air. Clean frequently touched objects and surfaces daily, such as tables, countertops, doorknobs, light switches, and cabinet handles with household cleaners and disinfectants. Stay home if you're sick. If you have a fever, cough, and difficulty breathing, seek medical care, but be sure to call in advance. Your medical provider will be able to direct you to the appropriate facility in your area. Lastly, follow the CDC's recommendations for using a face mask. Face masks are not recommended for use by the general public. Rather, face masks should be worn by people who show symptoms of COVID-19 to help prevent spreading the disease to others. Face masks should also be worn by people taking care of someone with COVID-19, such as loved ones or healthcare workers. While there is currently no vaccine to prevent COVID-19, staying up to date on your other vaccinations can help you stay healthy and protected against other respiratory infections, such as a seasonal flu or pneumonia. If you haven't already, ask your healthcare provider about which vaccinations are recommended for you. If you have any questions about how to best protect yourself against respiratory illnesses like COVID-19, talk to your healthcare provider.
Okay, so this is the video that tells you how to protect yourself. And here I have a few summaries as well. And here, first 3 points is the same as the last one. So that just means the first 3 points is very important. First, wash your hands often, at least 20 seconds. Next, avoid touching your eyes, nose, and mouth. Third, keep yourself at least 2 meters to others. Last is the new one, but it's very important as well. Clean frequency touched objects and surface daily. And now I need to say goodbye to you, and here I'm reminding you to protect yourself from the virus. Do the things in the video said. Thank you very much. Bye bye.